Tonight, March is Endometriosis Awareness Month. Learn the signs and symptoms and the right questions to ask a doctor when dealing with pain. Plus, have your questions answered in a live web chat with a women's health specialist on Family Matters, Women's Health, an ABC 27 special presentation sponsored by Penn State Health.
Good evening, I'm Deborah Pinkerton. Tonight is all about women's health. Penn State Health doctors will talk about a few very important topics, including symptoms of endometriosis and the latest treatment options, raising awareness of Black maternal health, and tips for dealing with menopause. And if you have questions at home, Denise McCracken is here to tell you how to get them answered. Hi, Denise.
Hi, Deborah. Thank you. Yes, joining us tonight is Dr. Sarah Horvath with Penn State Health, and she will be answering your questions live tonight until 8 o'clock in a web chat. If you'd like to submit a question, go to abc27.com/women's, and I'll be back later in the show to share many of those with you.
Thank you, Denise. Many women suffer from pelvic pain and struggle to get answers. March is Endometriosis Awareness Month. Penn State Health is here to talk about the importance of endometriosis education and why it's critical that women are heard when they have questions about their own health. And joining us right now is Dr. Kristen Riley, Chief of Minimally Invasive GYN Surgery at Penn State Health. Thanks for being with us.
Happy to be here.
Endometriosis is a very painful disorder that often goes undiagnosed. So tell us, what is it?
So endometriosis is a chronic inflammatory condition that affects patients in a lot of ways. It occurs when tissue that's typically that grows inside the uterus is outside of the uterus in the pelvic cavity. It can cause a lot of inflammation and pain as well as infertility issues.
So why don't you talk to us about the symptoms when you say it oftentimes goes undiagnosed?
Yeah, so typically we think about patients having very painful periods, pain before, during, or after their periods, but many patients don't have that symptom. They may have bladder pain or bowel pain, they might have back pain, pelvic floor pain, pain with intercourse, or no pain at all.
So how do you diagnose it?
So listening to patients and their symptoms is helpful, but unfortunately there's no non-invasive way to diagnose endometriosis at this time. There's no blood test, there's no reliable imaging study. So the only reliable way to diagnose endometriosis is with a procedure called a laparoscopy. That's where a surgeon like myself makes small incision on your abdomen. We use a long skinny camera to look inside your pelvis for endometriosis and then remove it.
So because it goes undiagnosed so often, many times women are really dismissed when they're talking about this pain. At Penn State Health, your team really works to make sure women are heard and they're getting the care that they need. Talk to us about that.
So that's right. Often it can take up to 7 to 8, 10 years, for patients to get diagnosed with endometriosis.
That's a long time.
It sure is. And as that time passes, they develop other symptoms in addition to the pain that started their problems. As I mentioned, things like bowel pain, bladder pain. And so we have a multidisciplinary team that can help address all the problems that our patients might have with endometriosis and chronic pelvic pain.
So all of these doctors are under one roof.
That's right.
Why don't we talk about treatment options?
Sure.
Once it is diagnosed, what do you do?
So there are a lot of treatment options. Unfortunately, there's no cure for endometriosis. We think about medicine, surgery, and then complementary therapy. Medicines include things like hormonal therapies, pain medicine, and surgery, as I mentioned, to diagnose endometriosis, but also to help manage it. So we excise endometriosis. Some patients can benefit from hysterectomy, but that's not considered a cure either. In addition, we think about things like pelvic floor physical therapy, nerve injections, pain medication, like I mentioned.
So in addition to those things, are there any lifestyle changes or dietary adjustments that really can help alleviate the symptoms?
Sure, yeah. So we think about many changes to a patient's diet is one thing that can be helpful, especially for patients who have bowel symptoms. An anti-inflammatory diet or an elimination diet can be helpful for many patients. Exercise, things like yoga, pelvic floor physical therapy can also be helpful.
So how does this really affect fertility?
So we don't completely understand. And in fact, the amount of endometriosis that somebody has doesn't correlate with their fertility outcomes. About 30 to 50% of patients with endometriosis have infertility problems. So we work closely with our infertility colleagues to help patients who want to have a pregnancy.
Since this is a chronic disease, how does this really impact mental health and emotional well-being? It must be very difficult to be diagnosed with something like this.
Sure. So you can imagine if you've been dismissed for a decade with your pain, that can cause a lot of mental trauma and mental health issues off the bat. And a lot of our patients miss out on work and school and life events, which can also be very difficult. So it's very important for our patients to get the mental health care that they need in addition to the other treatments that we mentioned.
Let's talk about research. What are the latest research advancements or breakthroughs as far as understanding or having a better understanding of the treatment of endometriosis?
So a lot of the research is focused on that early diagnosis of endometriosis, trying to find a new non-invasive technique to diagnose endometriosis earlier. There are also a lot of new medical therapies available for endometriosis, and our surgical techniques continue to get better. At Penn State Health, we have a number of studies going on as well.
And that's certainly encouraging news. Yeah. So you are hosting a webinar on endometriosis, and anyone can attend. So why don't you talk to us about that event and why someone should really attend this?
Yeah, we're really excited to offer this webinar for patients to join. It's coming up in a few weeks. And it's an opportunity for patients to meet with some members of our team and get their questions answered in real time.
And so we have all the information there. It's March 20th from 6:30 to 7:30. You have a QR code there, so it's real easy. If you have any questions, this is the time to attend this.
Thank you so much.
Thank you, Dr. Riley. We really appreciate the information. And if you would like more information, or if you would like to schedule an appointment with an endometriosis specialist at Penn State Health Hershey Medical Center, you can call this number, 717-423-4190, or visit online at bit.ly/PSH-OBGYN. Now let's check in with Denise McCracken. Denise, what are some of the questions being asked?
Thanks, Deborah. We have a wide range of questions coming in this evening, and joining us is Dr. Sarah Horvath, Vice Chair of Research for the Department of Obstetrics and Gynecology at Penn State Health. You've been busy.
I have been. Nice to be here. Thank you.
Thank you for joining us. Our first viewer question is, my husband and I are ready to start a family. What should I be doing to prepare my body for pregnancy?
The best way to optimize a pregnancy is really to optimize your own health first. So thinking about getting really healthy eating habits, exercise habits, sleep habits going now. The other thing you want to think about for most people is starting a prenatal vitamin right away. We actually recommend that you're on one for 3 months before becoming pregnant, and there's no downside. It makes your hair and your nails look nice.
Our next viewer asks, does exercise help with menstrual cramps? And is there anything else I can be doing to help with that pain?
Exercise really can help with menstrual cramps. It's really just about finding the exercises that are right for you. So experimenting, playing around, there are really a lot of upsides to exercise anyway.
Very good. We'll check back with you later in the show. In the meantime, if you have a question at home, you can submit that at abc27.com/women's. Stay with us. We'll be right back.
The best teams attract the best talent. That's true on the football field and beyond. As Penn State Health opens new locations across Central PA and delivers superior care at its existing hospitals and clinics, it's looking for talented people from all backgrounds to fill positions throughout the organization. Think you got what it takes to join an exceptional healthcare team? Apply today at pennstatehealth.org/careers.
You're watching Family Matters, Women's Health on ABC 27, sponsored by Penn State Health.
Welcome back. Joining us is Dr. Tanya Wright, Chief of the Division of Academic Specialists, OBGYN at Penn State Health, and Kira Thomas-Britton, a patient at Penn State Health. Thanks for being with us.
Thank you for having me.
Dr. Wright, tonight really is all about making sure women are heard when it comes to their health and well-being. You are an advocate for educating our communities about the importance of Black maternal health. Talk to us about that.
Well, there is a maternal health crisis in this country, and the maternal death rate is increasing at an alarming rate, and it disproportionately affects Black women at 2 to 3 times the rate of white women. My goal as an obstetrician has always been to provide equitable care for all women, but because of this disparity, my focus has really been on educating Black women so that they're empowered to be able to advocate for themselves and their loved ones.
Yeah, that is certainly important. Talk to us about the cultural factors that contribute to the challenge really faced by Black mothers during pregnancy and childbirth.
The cultural factors are certainly significant, and they're grounded in a historic context, but also significant are the societal and health system factors as well. Many of these create barriers that lead to the poor health outcomes that we see. For example, Black women are more likely to experience overt racism and implicit bias, but also may experience issues with insurance coverage, transportation, food insecurity, personal safety, as well as stable housing.
Now, Kira, Dr. Wright is your doctor now, but before meeting her, you did not have a great experience when you were pregnant and when you also gave birth. Talk to us about that.
Right. So 7 years ago, I had my son, and at the time, I just wanted to have a female doctor. I figured I'd be in good hands. Unfortunately, what I found is that I was treated like a number, just in and out as quickly as possible. And that translated to my point of delivery. On that day that I delivered my son at 40 weeks, I found out that my doctor was not going to be there. And I had instead to rely on a stranger, essentially, to deliver my son safely, but it was someone I was not familiar with. And of course, that created a space where I did not even feel comfortable speaking to that doctor after I had my son, in terms of discussing any postpartum feelings I had or any discomfort. It was just not a safe space for me.
So, Doctor, how can healthcare providers really address the needs that Kira had and provide a positive patient experience for mom and baby?
Yeah, unfortunately, Kira's experiences are very reflective of many Black women's experiences across this country. Many Black women report that they felt not heard, not listened to. They have difficulty airing their concerns, leading to a lot of communication barriers. Black women are really seeking unbiased care, culturally sensitive care, where actually they're seeking to be able to have open communications with their doctor so that they're more involved in some of the care that they're experiencing.
So, Kira, after you felt like you were safe and you were in good hands with Dr. Wright, how did that really change your healthcare experience for the better?
So safe is the best word, because let's put it this way. I went to see Dr. Wright in March, and by April I was pregnant. So it just spoke to
Congratulations.
it spoke to how safe I felt and comfortable and I felt in her hands. And she took care of me from beginning to end. Even if she was not able to be present herself, she ensured that I was taken care of and that she checked in with me after. And that translated especially to postpartum, because unfortunately I developed postpartum preeclampsia. And again, because of the relationship I had with Dr. Wright, I knew I could reach out to her and she would ensure that I got taken care of.
Yeah, and just felt very comfortable doing that. And no matter what you were going through, you knew that she was there holding your hand.
Exactly, and that's important.
That is very important. Doctor, what role do community organizations and grassroots movements really play in advocating better Black maternal health care outcomes?
Yeah, so community organizations can play a really pivotal role. One of the best examples that I have for this locally is actually an organization called Patients Are Waiting. It's based out of Lancaster and led by Dr. Cherie Livingston. And that organization is really grounded in 2 fundamental principles. One, they're aggressively trying to recruit and train young physicians of color so that we're diversifying our workforce. And 2, they're recruiting doulas to be able to emotionally support and advocate for patients of color as well. These are 2 principles that have been scientifically proven to improve health outcomes in women at risk, specifically Black women.
So in fact, now you are planning a community event in April to really celebrate Black maternal health week actually in Harrisburg at the Whitaker Center. Tell us about that.
Yeah, so this is an event for educating the public. It is open to the public. It is a free event. It is sponsored by the Highmark Foundation and presented by the Obstetrics and Gynecology Department at Penn State. The keynote speaker will be Dr. Rachel Bond, who's a cardiologist who specializes in maternal heart health. And there'll be also roundtable education discussions led by a variety of experts from my department, centered on very important topics such as doula care, midwifery care, and other key information sessions as well. It will have snacks and treats and an art exhibition and free parking. And we're just looking forward to hosting patients from the area.
And the Whitaker Center is certainly a beautiful place to have an event like this. Kara, talk to us, how important is this community outreach?
So community outreach is important, especially for Black women. We're looking for resources. We're looking for places to go that we feel secure with, and having that outreach, of course, would help. I think also, additionally, you need to trust your gut. You need to trust that you can rely on someone that you've interacted with. This person, this doctor has your life in their hands. So you want to feel that you're more than a number. So that's important.
Yeah, that's what I was going to say. What advice can you give to women who are watching tonight?
Right. So like I said, trusting your gut. And I think we need to have more candid conversations among each other, whether it be talking to your friends, your neighbors, your coworker if you get down like that, but just sharing those stories, and you'd realize that everyone has a shared experience, especially as Black women. And we need to embrace that and share that information among each other.
And doctor, what can all of us do to really support Black mothers and promote equity in maternal health care?
Yeah, I'm just so grateful for this opportunity, because just having the opportunity to share this this knowledge brings awareness, and awareness leads to advocacy, and advocacy leads to action. And everyone is welcome to be a part of this very strong community that we're trying to build to support Black women. This is a crisis that affects Black women, yes, but it affects all women. So if we fix this maternal health crisis for Black women, we're essentially fixing the health experience for all women. If there are health professionals that are listening tonight, I would encourage them to continue to work aggressively to listen to patients so that they feel heard, and also ask questions that maybe will bring out other things that are happening in their lives that they should factor into their health experience.
Thank you both for being here this evening.
Thank you.
Thank you.
And if you would like to make an appointment with Dr. Wright at Penn State Health Medical Group in Camp Hill, you can call this number 717-310-7624 or visit online at bit.ly/PSH-OBGYN. Now let's check in with Denise and get some more answers to our web chat questions. Denise.
Thanks, Deborah. Back with us is Dr. Sarah Horvath. She is the Vice Chair of Research for the Department of Obstetrics and Gynecology at Penn State Health. Our next viewer asks, I had a colposcopy after discovering I had HPV. Will I need another one if my pap smears continue to be abnormal, even if they found no evidence of cancer?
You might. We have really good algorithms based on robust research that tell us if and when a patient needs to undergo additional testing or treatment. And all of that is really in service of making sure that we catch cervical cancer when it's still a precancer and before it can ever become an actual cancer. And so it's really important that if your physician is telling you that your results are such that you should come in for another colposcopy, you really need to go down that road so that we can keep you healthy and make sure that we're preventing that from happening.
Our next viewer asks, I have severe pain during ovulation. Should I be concerned, and when should I go to the doctor?
That's a really good question. Severe pain is never normal, and that always requires that you go and talk to somebody about it. However, if you're having what you can identify as being a pretty typical pain that happens mid-cycle, you're not alone. That's called Mittelschmerz, and it happens to almost half of people. About 40% of people will actually feel their ovulation.
That's very interesting. This viewer asks, I have had horrible morning sickness during my first trimester. Is there any advice on how to control the nausea?
First, I'm sorry, just hang in there. Second, it's different for everybody. So some people really find that crackers can be helpful and other things that are sort of in that carbohydrates. Other people find that having protein-rich foods like Greek yogurt can be helpful. Really eating small meals or snacks throughout the day to try to keep a little something in the stomach can be really, really helpful. Ginger is also helpful, and then avoiding really fatty foods or spicy foods can also help. And if you really just can't get to the point of controlling it on your own, come on in and see us, and we have medications we can use.
A lot of great advice. What are the symptoms of menopause, and at what age should a woman be looking out for those?
Another really good question. So the earliest that someone should really undergo menopause is 47, but many people will start to have perimenopause several years before that. So the perimenopause and into the menopause transition, you can have those hot flashes that everyone thinks about. Sometimes people will have sleep disturbances, or they'll notice changes to their energy or their mood as well. These are all really normal things. Actual menopause doesn't happen until after you've not had a period for a full year. But if you're having these symptoms before, during, or after that transition, it's really important to come and see us. We have a lot of medications and other modalities we can use. There's no reason to suffer.
About how long does menopause last for the typical woman?
Yeah, it usually takes about 2 to 3 years to go through the full transition.
Okay. Let's talk a little bit more about the endometriosis webinar that you have coming up. How can someone attend?
Yeah, that's really great. We have an endometriosis webinar coming up for the community. It's going to be on the evening of March 20th. And I believe that we should have a QR code that folks can use to access the details.
Very easy. You've been great. Thank you so much for all of your tips tonight.
Thanks so much.
And you will be here until 8 o'clock, so there is still time to get your question in at home. You can go to abc27.com/women's. Back to you, Deborah.
And thank you, Denise. Joining us is Dr. Vanessa McDonald, obstetrics and gynecology at Penn State Health Lancaster Medical Center. We've had a lot of really great information tonight about women being heard. So why don't we talk about the types of questions that really women should ask their OBGYN? We're talking when they start out in their early 20s all the way up.
So I think that when you first go to the gynecologist, you can ask pretty much any kind of question that you may have. And certainly I empower women to be able to do that. For example, what types of tests do I need at my particular age group? If you're interested in any additional testing, any questions about sex, sexual intercourse, any symptoms that you may be having, for example, perimenopause, menopause. Another issue or question that I think is helpful is, when do I get a pap smear? How long do I have to wait for my pap smear? When can I stop getting pap smears? Also about mammogram. That's another kind of hot topic. When should we start getting mammograms as women? How often should we be getting mammograms? When can we stop getting mammograms? And also, how do I deal with if I do have an abnormal pap smear? What do I do in that case?
Yes, certainly lots of questions. And I think foremost, you really need to feel comfortable with the woman or man that you are seeing.
Definitely.
So how often, as we're talking about this, as women age, how often should, you mentioned this, they get a pap smear?
So we are now starting pap smear screening at the age of 21. And so from 21 to 29, we recommend pap smears every 3 years, provided they're normal. Starting after age 30, we add HPV testing in addition to the pap smear. And if both of those are normal, then the patient can actually go every 5 years before their next pap smear would be due.
And then how long as you age?
As you age, we typically can stop screening at the age of 65, provided the patient doesn't have any history of any abnormal pap smears. Similarly, if a patient has a history of a hysterectomy for a benign reason, such as fibroids or abnormal bleeding, they can typically stop when they stop getting pap smear screening once they get their hysterectomy, again, provided they don't have any history of any abnormal pap smears in the past.
Now let's talk about perimenopause and also menopause. So what are the symptoms? Some may not recognize the symptoms. We all know about hot flashes.
Absolutely. So I agree. I think the biggest symptom that we know about is hot flashes, but there are certainly many others. With respect to perimenopause first, Many women may not have a lot of the symptoms that we typically attribute to menopause, but they will have the menstrual irregularities, meaning they may be able to go months without having a cycle. With respect to menopause and even perimenopause, some other symptoms can be vaginal dryness, mood changes, weight gain, decrease in libido or sex drive, just to name a few.
And what is your advice for women as far as coping with things like menopause?
So I think the first thing is just to begin to be comfortable with having those kind of open and honest conversations with your provider about what symptoms you're having, how they're affecting your life. I think some of the biggest questions are, one, what is menopause? 2, what symptoms can I expect, and what are the treatment options? Many women feel that they just have to, unfortunately, deal with the symptoms because it's just a part of life, something that women go through as menopause. However, we now have just so many different type of treatment options at our disposal. Some are hormonal, some are non-hormonal, many that have come on the scene that are recently FDA approved. So we have a lot that we can really offer patients.
Now, you are accepting new patients in Lancaster County. Tell us what they can expect when they come to see you.
Sure. I think at our practice, we strive to make sure that patients have a comfortable, a compassionate, and a personalized care, especially as we journey through them through all aspects of their life.
Okay, thank you so much for being here, and thanks for giving all of this advice. And we also send a special thanks to Kira for sharing her journey, and you, our viewers, for sending in your questions. Now, we have covered a number of topics this evening, so if you would like more information or if you would like to schedule an appointment with an endometriosis specialist at Penn State Health Hershey Medical Center, you can call this number, 717-423-4190, or visit online at bit.ly/PSH-OBGYN. If you would like to make an appointment with Dr. Wright at Penn State Health Medical Group in Camp Hill, this is the number to call, 717-310-7624, or visit online at bit.ly/PSH-OBGYN. And if you would like to make an appointment with Dr. McDonald at Penn State Health Lancaster Medical Center, call 717-925-7563 or visit online at bit.ly/PSH-OBGYN. We want to thank you for watching tonight, and we wish you good health.